All right. Well, hello, everyone. Welcome to our Pediatric Occupational Therapy Helping Struggling Children webinar, which is one in a series that we're doing monthly. Before I introduce our phenomenal experts, I did want to just let you know that make sure to follow us on Facebook and Instagram. We have a lot of other educational events and opportunities that if you follow us, that you will get notifications of those. Let me introduce myself. My name is Lori Watkin, and I work on the Theraplay family of companies on our outreach team. We also have running the show for us, if you will, Lauren Toulin and Jason Traverse from our marketing team. And they're going to ensure, fingers crossed, that this webinar runs smooth. Jason is also going to monitor questions. So we have a couple of tips here that we wanted to share with you for the webinar. Jason, if you can pull up that first slide for us. The webinar tips, actually, and then I'm going to introduce Kelly and Dr. Epler.
I think it's after. Okay. The welcome slide. Yeah, it is.
All right.
So we'll go back.
Yeah, so if you have any questions, please, we want this to be interactive. The more that you let us know what you want to know about, the more that we feel we can be helpful. So send them through the chat box. Jason's going to be monitoring that. And then all attendees will get a certificate of attendance emailed to them after the presentation. And if you are requesting Act 48 credits, you must fill out the Act 48 questions in the follow-up survey that will appear on the screen after the webinar has ended. And that'll be emailed to you. Requests for the credits must be in by Friday, April 9th. So just some helpful hints here with the webinar. So without further ado, I would like to introduce our experts. We feel very fortunate to have Dr. Danielle Epler with us, and she is a licensed clinical psychologist. For the past decade, she has worked with children and adolescents with developmental disabilities in a variety of settings. In addition to working with children and adolescents, Dr. Epler is also passionate about working with parents of children with developmental delays. She enjoys helping children with co-occurring disorders cope with depression, anxiety, and other behavioral and emotional disorders. She also offers comprehensive psychological testing and diagnostic evaluation services for children ages 2 and up. So if you're in the eastern part of Pennsylvania, she would be able to help you with evaluations. We also have Kelly Hiller, who joined the Theraplay team in September of 2016 with a Master's of Science from Salus University. Prior to managing the Kennett Square office in Pennsylvania, we do have people from all over the country. Kelly was a center manager of our Newark office in Delaware, worked at our Landenberg Center, and was a student at our Broomall office. Kelly, this is not Kelly's first appearance at one of our webinars. Thank you very much. But she enjoys having a team to collaborate with to support each child's overall success in therapy. She has years of experience working with children and especially enjoys working with those who have feeding difficulties and sensory processing challenges. Kelly is an advocate for occupational therapy. In fact, I think this whole webinar was her idea, and all the benefits that it can offer. So thanks to both of you very much for being here. And with that, I think we can get started, Jason.
Okay.
All righty, perfect. Thank you. We can go to the next one. So like Lori mentioned, I tried to get this going this month is occupational therapy month. And one of the biggest things that I found in my career is the lack of awareness. I feel that as an OT, I just want to advocate for what I do and how I can help kids that struggle. So this is just a quick definition of what OT is and what occupational therapists do. So they help people across their lifespan participate in things that they want and need to do through therapeutic use of everyday activities. So things that they need or want to do can be as specific as getting dressed in the morning to as broad as participating in play routines to just being able to follow directions. So it encompasses a lot. And I always feel that there's not enough awareness. So today we'll be talking a lot about what OT does and how we can help those that struggle. So commonly seen challenges that occupational therapists are looking at. These are 4 just general ones. They're not the only ones, but there are a lot big areas that OTs will work with kids across all ages from birth through, I work up through 21. So we'll go into a little bit more detail about them if you can press next. So sensory processing. Occupational therapists are specifically trained and specially trained in sensory processing. We work with the children and the families to help determine, what they need throughout their day as sensory input, sensory strategies to help them be successful. Again, this relates a lot to some of those kiddos that do have autism spectrum disorder. So knowing that they have autism, they have some sensory processing challenges. An occupational therapist is able to get in there and figure out what type of input they need to help them be successful in whatever they need to do. But you don't have to have a specific diagnosis to have sensory processing challenges. More than ever, I notice, we have kids that are seeking a lot of input. They're not getting enough input throughout their day. Everything is virtual. They're not moving. They're not climbing. They're not running around. And because of that, we're not getting the appropriate input. So it's presenting as, seeking input, or we may have more sensitivities to different types of things, maybe loud noise, textures, whatever it is. So OTs, we find what the challenges are and we figure out what exactly we need to do to support that child and promote optimal sensory processing. And so activities of daily living. So daily living skills can be dressing, brushing your teeth, washing your hair, cooking a simple meal. It encompasses things that we do every day that we need to do every day. So we work on these with children and older kids as well to help them be independent in things that are more challenging for them. So this could be as simple as helping them learn how to brush their teeth or put on their clothing, to something more complex. Like I work a lot of times with some older kids that have a hard time maybe planning out their day, being able to plan a meal, being able to make themselves a meal, showing independence in these types of skills. So we're able to kind of, again, see where their challenges are and jump in there and help them to be independent in those things. And then emotional regulation is a big one. This goes hand in hand a lot of times with my sensory processing support as well. So a lot of times we have kids that have a really hard time regulating their emotions. They don't have appropriate coping strategies to tolerate changes in their routine, to tolerate things that are hard for them. And so what that presents is as some emotional dysregulation. So I see this a lot of times, actually all the time with a lot of my sensory processing challenging kiddos, where we're working to help them understand their emotions, develop appropriate coping strategies or sensory strategies to help them manage. It could be as specific as truly giving them those specific tools that they can implement themselves, or putting them through different types of exercises or activities that help calm them, and educating the families and getting them very much involved to support the kid, especially if it's a younger child. So we'll work a lot of times with psychologists as well, after we get to a certain point where we feel like we're looking at it in a sensory lens. If we need more support, then we'll be reaching out to other disciplines as well. But again, this is a big thing that OTs work on. We have a lot of different regulation programs that we work with the kids to again, just get them to be more independent in regulating those emotions and tolerating those difficult situations. And then fine motor development, OTs work on this as well. This, could be as simple as related to like ADLs, activities of daily living, may it be buttoning, fastening, zippers, things like that, to are they able to complete simple puzzles? Are they able to form shapes, use scissors, write their name? Are they falling behind in school, difficult time being able to keep up with their peers? So again, we're looking at, I always look at what is the activity or routine that is most challenging, and then what the OT does is really looks through their lens and finds out specifically what skills are causing that challenge. Is it their fine motor development? Is it their visual motor development? Is it their sensory processing? Are they having a difficult time with regulating their emotions because what this fine motor activity is difficult? So we really are looking globally at, what is the routine that's challenging and what are the skills that we need to support to help them be more independent and successful. So I'll talk a little bit about this as well. So again, as an occupational therapist, I work with children that are on the spectrum. That is not solely the population that I work with. Again, we work with kids, variety of conditions, and some that are just not diagnosed at all. But specifically with autism, we do play a huge role in supporting the child's success. This can be as daily living skills, such as being able to execute toilet training, dressing, brushing teeth, other grooming skills. Again, this can be kiddos that are really young, where you're hoping that this is happening at like 3, 4, 5. But then also I'm working with older kids with autism that need to be independent in these daily living skills, and they need more support. Again, a lot of times with autism, we may be falling behind in school-based exercises or activities, may that be handwriting or cutting. So again, we're looking at those things. We're looking at gross motor skills as well. This very much relates to their sensory processing, their ability to motor plan, execute different types of play routines, navigate their environment. And again, using my sensory processing knowledge and my awareness, I'm able to help provide that appropriate support for them so that they can execute these types of activities. Other things that we're always looking at, their overall posture, their perceptual skills. Are they able to perceive the differences of different things that they're seeing visually? I mentioned about the awareness of their body and how they're able to position themselves in relation to others and how that impacts them socially. We're also looking at their visual skills. We're looking not specifically at their acuity, but how are their eyes moving? Are you able to adjust your gaze from one thing to the next? Are you able to smoothly scan across a piece of paper? We're looking at the routine. What's hard? Reading and writing. Okay, let's find that skill deficit that's really challenging them and support them in there as well. And then of course, kids, most important occupation is play. And so as an occupational therapist, I am very much focused on supporting their play development, their play engagement, and making sure that they're successful. So again, we're looking at their play skills and ensuring that they're keeping up with their siblings, their peers, and being able to successfully, participate. So again, this isn't just specific to autism. We are talking a lot about kids on the spectrum and how OTs can help, but you may be thinking of a child and you're like, actually, my kid actually does have a hard time with some of these things, but they don't have a diagnosis. Again, the diagnosis is just one thing out of all the things that we're looking at. So these are all different things that an occupational therapist can do to support you.
I wanted to hop in and highlight one thing just related to those daily living skills. I think you had noted that some of the older kids that you work with, some of it's actually teaching those important steps, but also that relationship between sensory processing and some of those daily living skills really go hand in hand. If you think about a little kid who's learning how to brush their teeth, there's so much sensory input in those situations between the brush, the taste, all of those things, brushing their hair, bathing, all of those have such big sensory input. So being able to teach those skills and then also take into consideration the sensory piece as well is huge.
So academic challenges, again, we're working with kids that may have academic challenges. The school's noticing that there's having some challenges with what they're doing in the school setting. So this may be kids that just really aren't being able to keep up with their peers. And we're not really sure, is it, they can't sit at the table, they're getting off of the table and they're walking around and getting themselves distracted and distracting others. Or they just are really truly falling behind, and the teachers are able to identify, hey, this is where they're having a hard time. So we're working with the families and the students to find out where is the struggle, where do we need support, and a lot of this can be looked at like this big term called executive functioning. And I think some people have heard about it and some may have not. It encompasses so many different areas that you need to be able to do, not only for academic success, but daily performance and daily skills and activities. So executive functioning, if we have kids that have difficulty with executive functioning, we're going to have a hard time planning, organizing, implementing, and carrying out a variety of different activities. May that be a school-based assignment, to following a morning routine, to getting out the door during the day. And if these things are challenging, we then may also have our emotional regulation impacted as well. So I feel that this is an area where families or even teachers may just kind of push it off to the side, like, oh, it's okay, give them time, they'll catch up, but know that we're here and we can help. And there may be some other underlying need that they need support in. And OTs are helpful in that way. Okay, and so then pandemic challenges. I think this has been a year for the record books, as everybody would probably agree. But there's been a lot of new challenges that our kids are having to face, our families are now facing, professionals are facing. And what I've seen is a rise in a lot of areas that families didn't realize were an issue prior to, and they may not have been, or maybe they were on the cusp, and then with everything going on, it just kind of escalated a little bit. So a lot of emotional regulation challenges. Our world has been flipped upside down. Kids are having a hard time managing the daily ins and outs of what is normal for them, or what was initially consistent for them is now not. So we're having a hard time regulating our emotions. We're having a hard time managing just things that didn't used to cause issues for us in the past. Attention has been tough. I mean, we're doing this virtual learning, and I don't know about you, but if I'm on a screen for a little while, my eyes are burning. I can't even manage it. That's why I became a therapist, so I didn't have to sit for so long. We need to move. And so when we are stuck in this virtual reality that everything is sedentary, we're missing out on all these opportunities to gain appropriate input for these kids. They need to move. They need to get that appropriate input to help them be successful. And so because of that, we're seeing a lot of increase in what is termed hyperactivity or inattention. But really, they're really just trying to get that sensory input that they're missing out on. Social skills development has been impacted. A lot of these kids need more, social interaction, and with everything being virtual, we're not picking up on those social cues. We're having a difficult time, building in those areas. And again, for some kids, it hasn't been a problem, but for those kids that were on the cusp of having some challenges with this in the past, this has been significantly challenged for them. I work in an outpatient model, so I do have families that come in for an increase in just pragmatic language and being able to communicate and have conversations with peers and in an appropriate manner, because they haven't had that opportunity to practice and do it in real life since the pandemic started. Organization, struggling to keeping up with work demands. this very much goes in that big umbrella term that I mentioned before, like executive functioning. So our world was flipped upside down. What we were initially organized in now is a completely different type of learning. We need to reorganize, revamp how we're keeping ourselves on track. And because of that, if we don't have a system in place, we're seeing some kids fall behind. And that's to no fault of them. It's just a new type of learning, and it's not what they're used to. And then I mentioned this already, but where we are seeing an increase in kids reporting pain, may it be due to poor posture or even just eye strain from the screens that they're using. A lot of times we're having kids, we're not looking at the posture and how they're sitting and what their workstation looks like. We really should be ensuring that, they're positioned in a way that's going to support their posture. And it's not going to, we don't have their head tucked and they're going to get some neck strain or slouching on a chair. We really want to promote the best working environment for them so that they can be successful. And then, of course, with everything being virtual, we are seeing an increase in fine motor and gross motor delays. Again, unfortunately, just due to that inactivity, the lack thereof opportunity to engage in these types of activities, may it be using your hands or running around, all those things. So these are all things that we have now seen a rise in our kiddos because of the pandemic. But again, just reminding yourself that, hey, if you feel like you're lost and you feel like you're not sure where to go, knowing that, occupational therapy is a profession that can support you and your child that it might be struggling right
now. So in addition to referrals for occupational therapy, psychological services often works hand in hand with OT and speech and physical therapists. So as Kelly had mentioned, there are a lot of areas that OT addresses related to executive functioning and related to emotion regulation. But there are also some areas that we can help augment or help support OT. If kiddos are having difficulties related to emotion regulation, sometimes there are underlying emotional or behavioral concerns that may be contributing to some of that. So working with an occupational therapist to understand if there's sensory processing challenges that will contribute, that is part of the picture. But also sometimes there is an increase in anxiety related to either separation from parents, or one of the things we're really starting to see as kids are starting to head back to school is there is some social anxiety, right? So the development of those social skills were kind of halted because they couldn't develop them through this screen in the same way, but skills that were already had may start to take steps backwards, and there might be some anxiety about heading back into the school setting and navigating those social interactions. Kids who have a history of trauma oftentimes may have difficulty with self-regulation and emotion regulation, and so that can be addressed in psychological services to help go in tandem with occupational therapy. Working on some of that parent-child relationship and teaching parents how to support their kids through a lot of these areas that OT is working on. One of the things that I do a lot of work with is parents who have gotten a recent diagnosis of autism for their child. That is a big shift in the way that they are going to be working with their kids, and it's a lot of services potentially. And so working with parents to help build that relationship and help them see their kid through a lens that is positive and a supportive lens, and say, okay, how do we support their sensory needs? These kids are a lot of times having a lot of sensory input, and instead of punishment or those types of things for kiddos, how can the parents learn to support those sensory needs that those kids are learning in OT, because it takes a really big shift in parents' mentality to say, like, I'm not going to punish or put in these behavioral strategies. I need to support my kids in these ways. And then at other times that true behavior management strategies are appropriate if it is not necessarily tied to sensory things, and teaching parents some of those more behavioral based strategies can be helpful. And then giving parents the confidence to implement them and the ability to implement them consistently, because sometimes that can be the most challenging thing for parents. I know I have to do X, Y, and Z, but when we're in the moment and we're in the grocery store and everyone's staring at me, it's so difficult. So helping parents gain that confidence to implement them consistently. And then also for testing, psychologists are able to do both psychological testing for diagnostic clarification. So are there underlying conditions or syndromes that may be contributing to some of these sensory or behavioral concerns or emotional concerns? So a question of autism or ADHD or anxiety can all be explored through psychological testing. And then also some psychoeducational testing, which is more focused in the school realm. So understanding, is my kiddo having a lot of difficulties at school because he's struggling with ADHD, or is there some underlying learning difficulties that are making it challenging, and that's why we're seeing really big behavioral concerns? Or is it a combination? What's contributing to some of these difficulties that we're seeing in a school setting? So that is part of how the psychology field helps work in tandem with OT. A lot of times after we do these evaluations, it's exploring how to best support those families through services like OT and speech, so that kids can gain those skills that they need to navigate just their daily world. So, yeah.
So that's kind of all of our just info out there for you guys. Now, like Laurie was mentioning at the opening, we really do want it to be interactive. I do want your questions. I feel like that's when the best discussion comes out, is when you guys get to ask those personal questions or just general questions that are coming in your head. So if anybody has any questions, go ahead and you can use the chat box, and then Jason will start running them off to us.
We did just get a question in from Taylor. Says, I just got accepted into graduate school for OT, and I am very interested in pediatrics, especially working with children on the spectrum and working with children struggling with sensory processing. I currently work as a behavior technician at an autism academy, where through ABA, we taught them daily living skills. This job caused me to become interested in autism and children struggling with sensory processing. Do you have any advice for me going into school and wanting to specialize in this?
Yeah, so I think it's great. I think that, one, that you're going into the profession. I'm a little biased, but I think that's fantastic. The one thing that I would, and again, from your experience, you may already know this, but the one thing to always keep in the back of your head is when you're working with kids with sensory processing challenges, you're working with one kid with sensory processing challenge. I mean, you hear that with autism too. You're working with one kid with autism, you're working just with one kid with autism. It is very individualized. It is very child specific. So when you go in thinking, oh, I do this with all my patients, it works every single time. Not necessarily. We have to really be flexible and be able to think on our toes and know that there's not a one size fits all when you're dealing with children that have a diagnosis of autism, but also just keeping that in the back of your head with sensory processing. And the other thing is too, when you're thinking about sensory processing, and this goes on a little bit of a tangent, but look at what the child is doing, right? So like if they're exploring their environment and you're noticing their behaviors, no behavior is accidental. They're doing it for a purpose. If they are constantly touching the wall and they can't keep their hands to themselves, they're not trying to do that out of a behavior. They need some type of input, which is they're getting from doing that. So keep that in the back of your mind. And I think that's the biggest thing that I drive home to my families when I'm educating them on this is, listen, everything that they're doing is for a purpose. And so we just need to help them do it in an appropriate way or provide them with the input in a different type of situation that we may not see that type of behavior come out, if it is coming out as a negative behavior. So hopefully that answers your question, but way to go for choosing OT.
If I can just hop in here. So Taylor, depending where you're going to school or where you're from, we have a great student program.
Brenda would like to know if there is a specific exam for sensory issues.
So we do use, we do use different type of questionnaires that are standardized that we use with families. We use the sensory processing measure, and we also use this sensory profile that gives us a better look at what their sensory processing looks like. It also is age range, so it compares it to same age peers, and it breaks it up between all the different types of input, so tactile, vestibular, proprioceptive input, and so the occupational therapist would be providing that that test to the family or the teacher, and then they would be interpreting what that means. There is also specialty testing. Now, there's the SIP, the sensory integration praxis test, that is actually it's very expensive, and they're actually looking to discontinue that, but they are looking to a more standardized sensory processing test or examination that is in the works of being developed. I know that they stopped doing the other one so much because it was super expensive, and they found that the sensory processing measure and the sensory profile provided families with a lot of information. But those would be the things that we're looking at. And I really think not even just using that, but family interview and what you guys are sharing with us means so much. And we're able truly to get a good picture of what is going on with their sensory processing just by working with, not only talking with you, but then observing the kiddo and what they're doing.
Josephine asks, what are some extracurricular activities that you've seen help like elementary age children with ASD with sensory processing challenges?
So like extracurricular
with Asperger's, I'm sorry.
So I mean, I guess it kind of depends on the child's interests and what what the goal is, right? So, I mean, I don't think there's one specific extracurricular activity that I'd say, oh, you should absolutely enroll them into this. I feel that we should find what one is a child motivated by, and where can they get appropriate, maybe socialization? Can they get appropriate? Are they moving? Are they able to, support some motor planning, getting them some sensory input in that way? Dr. Epler, I don't know if you have any specifics that you've noticed, but for me, I feel like getting them involved is great. I don't think there's one in particular that would be better than the other.
And I think that the sensory, like the specific sensory input that is either averse to them or that they seek out is going to be really important. I know that there are some things that we often recommend for like learning self-regulation skills, activities that do teach them how to kind of clue into their body and learn how to like regulate. So things like karate and yoga and those types of things, there's a lot of focus on that self-regulation. But specifically for sensory, I think that's going to be pretty dependent on where their profile falls.
Well, before my next question here, I do want to just let everybody know, because at least one person has asked this so far. A recording of this will be available on our Facebook, and elsewhere. So you will have the ability to watch this afterwards. So Kelly wants to know, how do psychologists and OTs help kids with OCD?
Dr. Epler, do you want to take that one?
Sure. So from the psychology lens, a lot of the work is done trying to focus on the obsessive thoughts that often are seen in OCD. So trying to understand kind of what those thoughts look like. And oftentimes there is an anxiety component related to those thoughts that are experienced. And so working to learn how to challenge those thoughts and tolerate some of the discomfort that comes with those anxious thoughts, and help challenge the assumptions that if those thoughts or compulsions are not acted on, that something like bad might happen, or that they won't be able to tolerate the discomfort. So for example, if I don't do X, Y, and Z, something bad might happen, or that it will just be very distressing and I can't tolerate it. And so working on understanding those and learning that if I don't do these things, X, Y, and Z will not happen. I can tolerate it. So a lot of that is working on the anxiety piece for OCD.
And then from an OT perspective, I mean, we're obviously always looking at our sensory lens. Where does this obsessive compulsive behavior drive from? Is there a sensory need that's not being met, and that's why they have to do this one thing all the time, every time? So we're looking at it that way and seeing if there is something that they need, maybe some type of sensory strategy that they need to be implementing that will help them during these different times. Also, sometimes they just need more appropriate ways to maybe organize, or providing some type of organization that'll help them feel like they have a little bit of control. Sometimes in these situations, they don't feel like they have control, and that's when we see these different OCD behaviors come out. So OTs will work with families and children to help develop some type of organization that helps them feel like they can conquer whatever is going on when these things do happen. But again, with OTs are always looking at the sensory end of things as well.
Stasha would like to know, I was wondering if my son might also have sensory processing issues because he seeks out a lot of deep pressure and hugs, and he jumps around a lot and has a lot of energy. Will OT help with some of those sensory processing issues?
Absolutely, yes. So that is a typical kiddo that I see all the time, right? That constantly, jumping off of sofas into pillows, don't even know their own strength. Sometimes they're squeezing too hard. Again, any type of behavior is for a goal for them. So whatever they're doing is making them feel good. They need that. What OTs do is, okay, well, we can't be squeezing really hard friends, and we can't be, running into walls or jumping in onto couch pillows. We need to develop an appropriate way to get that type of input throughout their day, that it's not being disruptive in the daily activities and routines that they need to do. So OTs get in there, they look at, hey, what is this child seeking, and how can we give him that appropriate input throughout their day to help him be more organized and regulated, and that'll make the rest of his activities and routines not as disruptive, or he'll feel more organized, more attentive. So absolutely, that is a lot of my kiddos that I'm seeing now with those types of concerns.
This is an interesting one from Allie. What are your best tips on working with children who have escaping behaviors?
So, so we have a lot of kiddos that will elope or escape, depending if I'm understanding it the same way that I'm thinking. We'll have kiddos that won't tolerate an activity, so they'll run out of the room, right? They won't tolerate maintaining their attention or participating in any adult direction, so they're running away. So again, from an OT perspective, what I'm looking at, there's a variety of different things that we could be looking at. One specifically being their sensory processing. what are we trying to get them to participate in? Are we ensuring that whatever it is, they're getting some nice input that we know will help them be organized? So again, this is a lot of trial and error as you get to know the kid, because again, sensory is not black and white, it's very child individualized. So we're trying to figure out what type of input they respond nice to or well to, and ensure that we're encouraging and incorporating a lot of different sensory based exercises to see if that helps with their attention and regulation. We're also, again, we're using different behavioral strategies that in conjunction with the sensory approach. So is that sticker charts using first then language? Is it using a visual schedule, timers, things like that? Their behavioral strategies are very helpful and they provide structure, and some kids benefit really well from that. But again, it's not, when it comes with behavior and sensory, it's not black and white, and it is very much individualized. And again, it's a lot of working with the child and with the family to figure out how we best can support that, and hopefully that will decrease some of that behavior.
I also think paying attention to the skill or the activity that you're asking them to do. Oftentimes escape behaviors for me indicate that something's either too hard or, there's something that is unpleasant to them. It may be the sensory piece. It may be that it's too challenging and we're asking them to do it too long, or we are asking them to do it right after they're doing something that they really, really like and they don't want to transition from. So paying attention to the actual behavior that you're asking them to do, and what is it kind of sandwiched between? Is it like right after they were just playing a game that they really liked, and now you're asking them to go do schoolwork and they're like, no, I don't want to do that. I'm going to engage in escape behavior. So why? And then how do we better set up their environment for success? Like maybe we don't jump from playing video games that they really like to sitting down and doing homework, but we put something else in there that makes that transition a little easier, that they can make that transition or not make it so long, so it's so overwhelming. So I think trying to understand what they're trying to escape from is helpful.
Josephine would like to know, what are some examples of OT goals in a public school setting, like elementary level, for Asperger's, for emotional regulation?
Yeah, so again, it's when it comes in a school-based setting, they're very much focused on how it impacts their school performance, right? So they're going to make sure that their goals are going to support them in the school. So emotional regulation, it could truly be, will be able to, identify and implement a coping strategy during a challenging activity. It may be something as will participate in, will use visuals to help them, implement a sensory or coping strategy when things are challenging. It's very individualized for the kid. They're going to look at where are they falling flat, right? So where is it falling apart? And then is it impacting their school? Okay, this child needs to participate in sensory-based exercises prior to sitting at the tabletop to do, their writing or whatever it is to help support the regulation, as noted by implementing all these different types of things that they'll work with the teacher, with all the other team members to ensure that that's getting carried out. So it's hard to say what one goal would be. It's very individualized to the kid, but they're looking at making sure that they're successful. So if that is developing and implementing coping strategies, if that's giving them input prior to a challenging activity to help their attention and participation, which supports the regulation, it could be a variety of different things like that.
Megan says, I work with infants and toddlers and see a lot of feeding concerns. Are there resources that you would recommend to share with parents?
Yeah, so I love feeding. It's one of my favorite areas that I like to work with. I'm trying to think like resources specifically. Depending on what the child's needs are with feeding, may it be that they're not transitioning through different textures, may it be that they're having a hard time managing different textures, or they're very restricted in their diet and they're pushing things out. There are a variety of different avenues to go for feeding. So they may, want to see a speech therapist or an occupational therapist, depending on what the concerns are. The biggest thing I always say is, go to your pediatrician, ask, bring it to their attention of, hey, we're having some difficulties with feeding, and know that OT and speech are resources for that. We work with, infants through adolescence for feeding. And so we're able to figure out where the area, what's most challenging due to the feeding. I had a kiddo that I worked with who was 1, who came with me, and they were progressing through stages of food. And then through the evaluation, I noticed that she had a tongue tie. So she was unable to move her tongue, which is why she wasn't being able to manage different types of food. So then I reached out to the doctor and referred out to get that evaluated by another specialist. So again, talking to your pediatrician is very important, and letting them know what your concerns are, and hopefully just continuously, can't put it enough out there, but PT and OT, or I'm sorry, speech and OT are there to help as well.
Brenda asks, can OT help with fear and anxiety?
Yeah, we work with a lot of emotional regulation, and emotional regulation encompasses so much, right? So it encompasses, anger and frustration, but it also incorporates sadness, anxiety, nerves. And so we have a lot of different programs that we use that, again, they're using that sensory realm, but they're helping kids identify their emotions. They're able to identify why they feel that way, what are they supposed to feel in this emotion? If they don't feel that way, how can they get themselves to feel the right way? So for example, we have one program that we use all the time that is the zones of regulation, and it teaches kids about their emotions, and we categorize it in different colors. So, if I'm nervous, I might be in the yellow zone. If I'm angry, I'm in the red. I'm happy, I'm green. Sad, I'm blue. And there's a bunch of different emotions that we teach kids about. We have them identify what those feelings are. We help them be able to categorize them into colors. And sometimes that in itself helps kids advocate for themselves. It's very hard in a moment of distress and anxiety and nervousness. When someone's asking, what's wrong with you? It's hard for me to say how I feel. But if I can say, I'm in the yellow zone and I need help, that might be what they need to support them. Now, again, we'll work through these types of programs, help them develop increased awareness of their emotions and strategies. But we may get to a point where we want to reach out to psychology services to support them even further. So we work very closely with the psychologists and to ensure that they're, improving in those areas of need.
Taylor asked, do you encourage weighted vests and blankets to help children get the sensory input they need?
So that is definitely a great tool to use for kiddos. Again, it's very child specific. The one thing that I've noticed that many families don't know, or feel like there's so many weighted blankets out there that the advertisements are like, oh, it's great to calm. Now, what I always tell my families is if a kid is seeking deep pressure, or they're seeking they need heavy work. So we need to put some weight on them to give them more input. I think it's a great tool. What families don't realize, and companies don't realize, is that if we provide that type of input for more than 20 minutes at a time, it's teaching our central nervous system that that's what's now considered normal. And so we need to do it in short increments, right? So if we do it we put them to sleep with the blanket, eventually that weighted blanket isn't going to do the needs that we want it to do the next time, or 5 times from then. So we need to remember that it's used as a tool. It's used as a strategy to help us feel more regulated. It shouldn't be done for an extended period of time, because again, it's teaching our sensory system this is what's supposed to feel like. So then if I need it, it's not going to do the same type of effect that it would for if we were doing it appropriately. But it is a great tool. Just have to do it the right way.
I think on a somewhat related note, Stasha asks, do you recommend Chewy tubes for the oral sensory input? And do you have any recommendations for good Chewy tubes?
Yes, we recommend Chewy tubes all the time for our kiddos that are maybe seeking a lot of input. There are those kids that maybe having their shirt in their mouth even. There are some great things out there now that help it to be a little bit more discreet, I guess. Instead of walking around with a tube that they need to chew, there is they call jewelry. So may it be a bracelet or a necklace that they can just kind of pull out and chew when they need to. I find that's really helpful. Again, I always try to tell families, like I had one family a couple of years back where I recommended a Chewy tube, and she was like, well, no, I just don't want him to have it at all. Like, I don't want him to need it. I'm like, well, listen, what I need to educate to you is that he's doing it for a reason. He needs that type of input. So again, if we can give him this input, we may see less of it in the future, and it's going to support his needs. So I think Chewy tubes are great. Jewelry is great, and like I said, you can look out there. There's a bunch of different variety where different resistance. Some are harder to chew, some are less, some have textures on it. But they are great tools to use. And if one doesn't work, try a different one, because again, there's varying of textures, of varying of resistance, and finding that what is the best for that kiddo. But I think they're great.
Gloria asks, what about teeth grinding for people with autism?
Yeah, so there's a lot that goes on with a kiddo with autism. One in particular is, again, their sensory processing is not, we're going to have challenges in sensory processing. It comes with a diagnosis. So depending on the teeth grinding, a lot of times when they do that, they're getting some deep pressure when they grind their teeth. There might be a way that may calm them. That may send some neural signal to their brain that then helps them calm. Because again, every behavior they do, it's for a purpose. So if they are grinding their teeth, can we, use a replacement behavior that they can get that same type of input? Can we use a Chewy tube? Is that going to support that that need? Sometimes I've even found that we'll see like very discrete sensory behaviors. May it be grinding your teeth, or even like sensitivity to clothing, where we could do a whole body sensory experience that will help give them so much nice input that they need, that we may see less of those individualized sensory exercises or activities that they're doing. So again, we're just trying to find what is the need, what is the goal for them to do that behavior. And again, with children with autism, majority of the time, it really does have to do with their sensory processing. And then I guess Dr. Epler can talk about it too, but I know, anxiety and stress, that also can impact grinding of your teeth. So looking for support there too.
Yeah. And a lot of that is going to be increased like awareness of like body sensations and learning some relaxation strategies. People carry a lot of tension in this, either their neck or their jaw, which can contribute to teeth like grinding or clenching. And so learning how to do like body scans and relaxation strategies to try to minimize some of that for people who are carrying a lot of like tension and anxiety can be helpful.
Here's another interesting question. My child is 4 years old. Can kids that young really experience anxiety?
Yeah. So kids who are, oftentimes we see kids who are born who have temperaments that are a little bit more anxious and will develop anxiety related to separation from parents. When kids are dropped off at like preschool programs, it's not uncommon for them to experience some separation challenges, but a lot of times it's a few weeks and they're able to kind of transition. But so some separation anxiety occurs when that transition is really difficult for children. We're going through like a national global pandemic. There's been a huge influx of anxiety related to illness and to just general anxiety because parents are anxious. And so we do see kids coming in 3-4 years old who are experiencing anxiety. And so there's been a huge influx lately related to that.
All right, I think we got time for about one more here. What is the difference in how an OT addresses emotional regulation versus a psychologist / behavioral specialist?
So that's a great question. So again, it all depends on, I feel like we work very closely together. I feel like a lot of times I will refer out after a while if I'm having a hard time. But what an occupational therapist is doing is they're looking at it as in a sensory lens, right? So they're looking at what, or not even just sensory lens, but maybe a skill deficit area, right? That we're having challenges in a certain activity that is causing distress, that is causing us to have an emotional outburst, that is not letting us tolerate this activity. So an occupational therapist is going to acknowledge that and then look deeper and say, okay, so what is the root cause of this? What is the trigger for this? Is it due to general overall sensory processing challenges throughout their day that they're unable to manage? Is it because that type of activity is an activity for which they have a difficult time with writing, or they have a really hard time sitting still at a table because they have really a weak core and they can't maintain that static position? So we're looking at, like I said, we're looking at all the different skill deficit areas that could be impacting that performance. And then we're working with the families and the children to help develop coping strategies, identifying their emotions, and then using those sensory strategies to help manage it. But again, I feel like I'm constantly referring out and reaching out to my psychology team members and just saying, hey, listen, like, this is what we've been doing. This is the programs that we've utilized. We need more support. And so sometimes it's great to have that connection because I feel like there's I shouldn't speak for you, but I feel like there's a lot more conversations going on. There's a lot more digging deep to I don't know. I should let you finish.
No, you're good. Yeah, I think that there is a lot of, in some of that, like emotion regulation and behavioral challenges, there is a lot of overlap in how we support each other. But in the psych realm, a lot of the work is trying to understand from like a family perspective, are there things that are maintaining some of those behaviors? If it's not related to like sensory challenges, and if some emotion regulation strategies aren't working, how do we address any underlying like emotional depression, anxiety, those types of concerns that are resulting in difficulties in those areas? And then are there ways that we can work with the family? Sometimes, it's little brother who is secretly back there, just pushing buttons and those types of things. And so being able to work in like full family dynamics is super helpful sometimes because there are other things at play, and it's important to try to address some of those.
All right, Kelly and Dr. Epler, thank you so much for all of your expertise and answering your questions and all of the information. We are so happy you could join us tonight. Thank you to all of our attendees that were able to join. Just a reminder, a survey is going to pop up at the end and it'll also be emailed to you. So please fill that out. That helps us to bring you topics that you're interested in, times that work for you. Like Jason said, we will be sending out a link to the video to everyone. You'll be getting a certificate of attendance. And if you need those Act 48 credits, those questions will be in that survey as well. So
And thank you for all the great questions that we received.
Yeah.
That was really great.
Yeah, thank you, everyone. I'm not sure how to undo my video, but
it
thank you.
happens with every call.
Yeah. Have a great night, and please let us know too on the survey if there's other topics that you'd like to see from us. Please make sure that you add that into your comments. So,
Great. Thank you, everyone.
all right. Thank you.
Thank you.
Good night.
Good night.